Look, if you've crossed the 45-year mark and you've ever thought about anal sex, or maybe you're already doing it with your partner, you need to stop right now and listen up. There's something nobody talks about openly, something that could either transform your intimate life or absolutely wreck your health. I'm not exaggerating here, and honestly, most people find out way too late, when they're already sitting in a surgeon's office being told they need an operation. After 45, your body ain't what it used to be. Everything changes. Your sensitivity shifts, your tissues become different, and what loads of folks are doing behind closed doors, without proper guidance, can cause damage that's sometimes impossible to fix. We're not just talking about a little discomfort or some bleeding during the act. We're talking about serious, life-altering complications. I've seen patients who, after just one poorly executed encounter, started eliminating feces through their vagina. Yeah, you heard that right. Urinary tract infections that won't respond to antibiotics, vaginal discharge that gynecologists can't treat, and even fecal incontinence where people lose complete control over their bowel movements as time goes on. It's embarrassing, it's devastating, and it's happening more than you'd think. Here's an alarming stat that'll make your jaw drop. Anal sex accounts for nearly 80% of HIV transmission cases, and almost nobody knows this. But hold on, I'm not here to demonize anal sex. Far from it. This video is a wake-up call based on real cases and medical explanations for anyone who wants to explore their sexuality with freedom and responsibility. I'm gonna share things with you that you've probably never heard anywhere else. For instance, there's one position that almost everyone uses, and it's the most dangerous one out there. There are lubricants that'll dramatically increase your chances of ending up in surgery, and there's a specific anatomical detail that, if ignored, can cause irreversible damage. The worst part is that nobody's telling you this stuff, but what doctors are seeing behind closed doors is genuinely shocking, and the complications are piling up faster than ever before. Now, regardless of what I personally think or believe, people are gonna keep practicing anal intercourse. And let me tell you something that might surprise you. I have patients, both men and women, who travel across state lines just to reach my city, paying out of pocket for private consultations, simply to talk about anal sex. They're desperate for answers, terrified of what might happen, and most of them have already experienced some kind of problem. This is information I'm bringing you firsthand from a specialist who's been in the trenches for over 2 decades. Here's what's really going on. Sexual activity among Brazilians and people worldwide has skyrocketed. We've got 70-year-olds maintaining extremely active sex lives. A study from November 2024 showed a 38% increase in sexual encounters among people in this age bracket, and a huge chunk of this revolves around anal intercourse. Women constantly complain that their male partners always want to try anal, and obviously for homosexual individuals, anal intercourse is practiced way more frequently. So tons of questions are popping up, and as a specialist, I'm gonna lay it all out for you. Because whether I think it's right or wrong doesn't matter. People will keep doing it. And if you don't have the knowledge I'm about to share, the consequences aren't just serious, they're catastrophic, and understanding the anatomy is where everything begins. Let's dive into anatomy, 'cause this is where most people get it completely wrong. We've got 2 muscles in the anal region called sphincters. There's the external sphincter and the internal sphincter deep inside. Everyone's got 'em. The external sphincter is the one that kicks in when you're desperate to go but you're stuck somewhere inappropriate, and you gotta hold it. It doesn't have massive strength, but it does the job. However, the internal sphincter is one of the most powerful muscles in your entire body. It stays completely closed like a fortress gate, and only opens when you're actually defecating. Now think about this for a second. Anal sex is fundamentally different from vaginal penetration because the vaginal opening is semi-open. It's designed for entry. But the anus is like trying to force your way through a locked steel door. The internal sphincter doesn't want anything coming in. That's literally its entire purpose in life. If you try to penetrate that sphincter too quickly, too roughly, without proper preparation, you're going to cause damage. And remember, this muscle is responsible for preventing fecal incontinence. It's the guardian that keeps you from losing control of your bowel movements. So when you mess it up, you're messing with something that controls a fundamental aspect of your dignity and daily life. This isn't about pleasure anymore, it's about whether you'll be wearing diapers in your 50s or 60s. And that's exactly why the preparation phase isn't optional, it's absolutely critical. Here's a massive tip that could save you from a world of hurt. Whenever you're initiating anal intercourse, you absolutely must perform an external massage on the anal region first. This relaxes the sphincter muscles, and there's no way around it. When I examine patients in my office during proctological exams, I don't just dive in with a digital exam. I grab a lubricant and massage the external area for about 5 seconds. Then, with that same lubricant, I slowly introduce just the pad of my finger, gently, to allow those sphincters to understand they need to go through a relaxation process. So here's your first critical tip. Always use water-based lubricant. Don't even think about using oil-based lubricants, scented lubricants, or flavored ones. Those typically contain silicone and are way more oily. If you develop an anal fissure, which is basically a tear in the anal region, with an oil-based product, it's going to be incredibly difficult to heal without surgical intervention to correct that fissure. It's gotta be water-based, period. So that's step 1, external massage for 5 seconds, then a gentle introduction with just your fingertip into the anal sphincter. This is the foundation, the absolute baseline. But here's what nobody tells you. Even with perfect lubrication and massage, if you use the wrong position, you're basically setting yourself up for disaster, and the most popular position out there is actually the most dangerous one imaginable. Now we're getting to a tip that only a specialist can give you about anal sex positions. The most common position for anal intercourse is the genitopectoral position. What's that mean? It's when the receptive partner is on all fours, kneeling. And this position is hands down the worst way to start anal intercourse. Why? Because the rectum, despite its name, isn't straight at all. The rectum is curved. And here's the detail I share even in lectures for non-specialist doctors. The penis must always be directed toward the navel of the partner who's receiving the anal penetration. Think about it. If someone's on their knees, their navel is pointing downward, but an erect penis is pointing upward or straight ahead. You're going completely against the natural curve of the rectum. This dramatically increases the risk of sphincter damage, anal fissures, which are cuts in the anal region causing excruciating pain, and it can also damage the internal sphincter, leading to fecal incontinence down the road. The correct starting position is always lying on your side, lateral position, like you'd sleep on your side. This way, the partner's penis naturally points toward the receptive partner's navel. It follows the anatomical curve instead of fighting against it. This is specialist-level advice that you won't find in some random blog post or hear from your friends. And remember, when you're using that water-based lubricant, you've got to lubricate both the anus and the tip of the penis. I see tons of people only lubricating the anal region, and that's a huge mistake, but there's another aspect of lubrication and movement that most folks completely ignore. Here's another crucial detail. Don't forget that the anal canal and lower rectum don't have natural lubrication like the vagina does. The vagina produces its own moisture during arousal, but your rectum doesn't give you that advantage. So beyond lubricating thoroughly, the in and out movements must be slow. They can't be rapid or aggressive because fast movements dramatically increase the risk of damaging the anal sphincter and causing lacerations. For many postmenopausal women, the sphincter muscles become slightly hypotonic, meaning more flaccid and less responsive. Rapid movements during anal intercourse can seriously aggravate this condition and accelerate the development of fecal incontinence. Now, people always ask me, "Doctor, do I have to stay in that side-lying position the entire time I'm having anal sex?" And here's the good news. Once you've started anal intercourse while lying on your side, you can absolutely change positions afterward. Why? Because the rectum has already gone through an accommodation process. It's adapted, it's relaxed, and the tissues have stretched appropriately. But starting in any other position is playing Russian roulette with your sphincter muscles. Another massively important thing people don't realize is the whole issue with condom use. And I'm going to tell you straight up, what I've been hearing for 20-30 years about this is putting people in serious danger. Do I really need to use a condom for anal sex? I've been hearing this question for decades, and the answer is absolutely critical. When there's penetration into the anus and lower rectum, the urethral opening of the penis, that tiny hole where urine comes out, comes into direct contact with the most contaminated area of the entire human body. The highest concentration of bacteria per cubic millimeter exists inside the rectum and anal canal. Those bacteria are going to penetrate into the urethra, and the consequences can be devastating. I've got male patients with recurring urinary tract infections that are extremely severe, and doctors can't figure out why until we discover it's from unprotected anal sex. The bacteria migrate up through the urethra and cause infections that are resistant to standard antibiotics. And here's something even more serious. If you perform anal intercourse and then vaginal penetration without using a condom, you're literally transferring the entire bacterial load from the rectum into the vagina. I can't tell you how many women come to me saying, "Doctor, I've seen multiple gynecologists, and I have vaginal discharge that nobody can cure, recurring yeast infections that keep coming back." Not every yeast infection is caused by anal sex, obviously. Sometimes it's dysbiosis, vaginosis, or alterations in the vaginal microbiota. But in many cases, this is exactly what's happening. If you go from vaginal to anal intercourse, there's no problem whatsoever. The problem is going from anal to vaginal without protection. You'll get recurring vaginal infections, recurring urinary tract infections, and chronic inflammatory conditions that are incredibly difficult to treat. And speaking of infections, there's one myth about hemorrhoids that needs to be cleared up right now. Lots of people ask me, "Doctor, will anal sex cause hemorrhoids?" Actually, no. Hemorrhoids aren't caused by anal intercourse itself. The problem is that if you're doing it without proper lubrication, with rapid movements, without using the correct position, and you already have hemorrhoidal disease, which becomes way more common after 45 or 50 years old due to the dilation of those blood vessels, you're going to cause bleeding, swelling, and potentially even hemorrhoidal thrombosis. That's when a blood clot forms inside a hemorrhoid, and the pain is absolutely unbearable. But here's an exclusive tip I'm giving you, especially for women in perimenopause or postmenopause. There's a test you can do right now. Try contracting your anus and see how many seconds you can hold it. If you can hold the contraction for close to 8 to 10 seconds, that means your sphincter muscles are in excellent condition. If you're holding it for less than that, you should seriously consider pelvic floor physical therapy to strengthen your pelvic and perineal muscles. Or you can do exercises at home that I teach my patients. 3 sessions of 10 minutes each, morning, afternoon, and night. Contract, hold as long as possible, and relax. Contract, hold, relax. This will dramatically improve muscle tone. And if you're planning to practice anal intercourse, it's incredibly important that your sphincter tone is well preserved. Now, let me share with you 3 cases that happen with my patients. Cases so serious, so embarrassing, and in one instance so life-threatening that they'll change how you think about this forever. I've got 3 cases involving my patients that were extremely serious. Some of them were profoundly embarrassing, and one of them carried genuine life-threatening risk. The first case was a 52-year-old woman who came to my office after a single episode of aggressive anal intercourse without proper preparation. She developed what we call a rectovaginal fistula, essentially, a tunnel formed between her rectum and vagina. This meant she was literally passing feces through her vaginal canal. The psychological trauma was immense, the social isolation was complete, and the surgical repair was complex, requiring multiple procedures. She told me through tears that one night of experimentation destroyed her marriage and her self-esteem for years. The second case involved a 48-year-old man who practiced receptive anal sex regularly without condoms. He developed a severe rectal abscess that progressed to Fournier's gangrene, a rapidly spreading infection of the genital and perineal tissue. This is a medical emergency with a mortality rate of up to 40%. We had to perform emergency surgery, removing necrotic tissue, and he spent 3 weeks in intensive care fighting for his life. All because bacteria from fecal matter entered through microscopic tears during unprotected intercourse. The third case was a 61-year-old woman in menopause who began experiencing fecal incontinence after just a few months of regular anal intercourse with her new partner. Her sphincter muscles, already weakened by age and hormonal changes, were completely destroyed by repetitive trauma. She now requires adult diapers and is scheduled for a complex sphincter repair surgery with no guarantee of success. These aren't scare tactics or made-up stories. They're real people whose lives changed forever because they didn't have the information you're getting right now. Listen, at the end of the day, your sexuality is yours to explore. I'm not here to judge, preach, or tell you what you should or shouldn't do in your bedroom. That's between you, your partner, and your own values. But what I am here to do is arm you with the medical facts that can protect you from devastating, life-altering complications. If you're over 45 and you're interested in anal sex, or you're already practicing it, you now know the essential rules. Always use water-based lubricant on both the anus and penis. Perform external massage for at least 5 seconds before any penetration. Start in a side-lying position where the penis points toward your partner's navel. Move slowly and never rush. Always use condoms to prevent bacterial contamination and STI transmission. And test your sphincter tone regularly if you're post-menopausal. These aren't suggestions, they're medical necessities. Your body changes dramatically after 45. Your tissues become less elastic, your muscles lose tone, your healing capacity decreases. What might have worked in your 30s could destroy your health in your 50s. The human body is an incredible machine, but it has limits, and the anal sphincter complex is one of the most critical structures for maintaining your dignity and quality of life. Fecal incontinence isn't just a medical condition, it's a social and psychological devastation that affects every aspect of your existence. So please, take this information seriously. Share it with your partner. Have honest conversations. If you're experiencing any pain, bleeding, changes in bowel control, or recurring infections, see a colorectal specialist immediately. Don't wait until the damage is irreversible. Your sexual health is part of your overall health, and it deserves the same attention and care you'd give to your heart, your lungs, or any other vital system. If this video helped you, if you learned something valuable, hit that like button and share it with someone who needs to hear this message. Subscribe to Planeta Intestino for more evidence-based health information that nobody else is willing to discuss openly. Remember, knowledge is protection, and ignorance can cost you everything. Take care of your body, respect its limits, and live your sexuality with both freedom and wisdom.